DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hey there, welcome to the show. I'm Dr. Dan Thomson. Thanks for joining me today on DocTalk. We're going to have a great show. My guest today is Dr. Jim Lilyc, and we're going to talk about something that is here and futuristic for medicine. It's regenerative medicine. It's going to be a great show. We're going to learn a lot. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Dr. Lilyc, welcome to the show.
Thank you.
Folks, this is Dr. Jim Lilyc. He's an associate professor here in the Department of Anatomy and Physiology at the College of Veterinary Medicine at Kansas State University. He's an incredible equine surgeon, does a lot with equine lameness, world-renowned, and today we're going to talk about something that's really exciting to me, and that's the application of regenerative medicine in horses and
where we take it from there.
Yeah. So kind of give us the rundown. What is regenerative medicine?
Well, it's a broad term, but basically it's trying to use what is within what's within the body in order to accelerate or maximize healing potential. So we know that wound healing is very, very complex and orchestrated by a number of different types of cells in the body. And what we're trying to do is use those cells and what they produce, and we can take them outside the body and grow them in the laboratory and then return them to the body so that the body can accelerate its ability to heal and maximize the healing potential. Rather than use other medications which really aren't necessarily designed for those things, or help in some regards, but let's be honest, Mother Nature's a whole lot smarter than we are. So we're just trying to use what she gives us, know a whole lot more about that process to regenerate tissues. And from the human side of things, the biggest problem is regenerating the spinal cord injury because it's a permanent deficit. From animals, it could be the same things that we deal with, whether it's arthritic change in a joint where you're no longer athletically productive or sound if you're a horse. If you've got an infection somewhere that you need to beat, and that could be within any tissue, and it is not toxic to the body if you use these cells and use these products.
So talk to me a little bit about the arthritis and so give me just kind of like a little description of what I'm going to do, what kind of tissue you're going to take and
Sure. So every tissue in the body, virtually every tissue in the body has got some way to replace itself. So we call those generally stem cells, and there's a lot of different terms, mesenchymal cells or mesenchymal stem cells that are generated from fat. They even can come from muscle, but most of the time we're generating these from fat. All right, so we can take a piece of fat from you, and the cells that can reproduce in the laboratory in underneath conditions that grow them could then expand and help direct or become or help tissue that is back in the body heal itself. All right, so we regenerate that tissue by ramping up those little itty bitty cells that are supposed to do the job. We just give more of them.
Okay,
right?
so you're just taking them from one place and putting them where they're needed.
Exactly. And we know a whole lot more about what they require outside and what they require inside. So that There's other, what they're called cytokines. These are signals within the body and proteins within the body that ramp those things up and get them to do their job.
Well, if you can take some fat off me, which Lord knows I know is regenerative, and put it in my knees, I'd be happy.
Exactly, and that hopefully will reduce the inflammation or cause the body to get better. Help maximize it.
All right, we're going to take a break, folks. When we come back, we're going to talk a little bit more about what we do know about regenerative medicine with Dr. Jim Lilyc.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Julia Simons grew up in Maryland and earned her master's in food systems and ag policy before attending veterinary school at the University of Wisconsin-Madison. Her goal is to provide high-quality veterinary care to livestock while protecting the food supply and the animals' well-being. She would like to work in the Northeast for a dairy or mixed animal practice after graduation.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with my friend and colleague, Dr. Jim Lilyc, who's an equine surgeon, and he's an associate professor here at the College of Veterinary Medicine in the Department of Anatomy and Physiology, and he is doing some outstanding research and really cutting edge things in taking human application to equine application, and there's much more we can do. But when we're talking about regenerative medicine, taking cells from one spot in the body, putting them where we need help and where we normally don't get good regeneration and healing, Dr. Lilyc is working on some things. So what are some things we know?
Well, so regenerative medicine's been with us for a while. There are some well-designed studies out there that document an effect, but we don't know exactly the metabolic or the exact mechanism of how that's going on. So Dr. Weiss, who's in my department as well, worked in the small animal clinic with a couple of the surgeons, and they did some fat cells derived in very damaged or hypnosplastic dogs. And the ones that were most severely affected, they seemed to improve. And it was statistically significant. So in the horse realm, we think that we can actually get potentially better tendon healing, things that are better for the joint, because wear and tear. I mean, athletic endeavors, you pay a penalty for that.
Right.
So if we can keep that system going, functioning at a peak, then we can get the most use out of it, and the quality of life can be better. Clearly that's what we're trying to do for people, is make their quality of life a whole lot better. So what we know is we can take cells, we can put them into certain locations, and we can now ramp them up, and we can improve the clinical conditions of an arthritis. We can improve a range of motion, or we can improve a level of comfort. Do we know exactly what's causing that yet? That's difficult to determine. I mean, we're looking at a molecular type thing. It's down below the cellular level to figure out if that is actually what's causing it.
So the signals from these cells, and I've got to get things down to kind of my level, but the fat cells or the different cells, they actually have the ability to send signals that might trigger the reaction in the cells that are locally.
They're either directing the traffic,
okay,
or becoming part of the tissue, being incorporated.
Okay.
Because we think that since they're pluripotent, that means that they can go from one cell type to another cell type potentially, or fill some of a supportive cellular level role.
So we put these tissues in, and they either have the signals and the tools that the other cells need to do the job,
exactly.
or they're just going to do the job for them and jump right in and become part of that tissue that.
Yeah, certainly, and some of them could be calling in a blood supply. We need more blood here. Some of them can say, hey, we've got a lot of inflammation in the area, and that's actually that's detrimental. Because inflammation is required for healing, but too much of it could destroy normal tissue or potentially slow the process. And we also know that the other side of the regenerative medicine deal is if we can get more comfortable, we can start to use the leg better. And if we use it and load it correctly and walk more correctly, hey, quality of life is improved, and we're probably stimulating healing in that regards.
Awesome.
It's rehabilitation.
Awesome.
Yeah.
Folks, Dr. Jim Lilyc here at the College of Veterinary Medicine. When we come back, we're going to talk about some things we don't know about regenerative medicine.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
Hello folks, this is Dr. Nels Lindberg with Animal Medical Center and Production Animal Consultation out of Great Bend, Kansas. Today's BQA Tip of the Day, we're going to visit about branding these cattle. Branding is a common procedure done throughout the United States and the world, but it's very important that we do the best we can to do that brand efficiently and in a timely manner. These cattle here turned out on right. We often brand these sort of cattle when they're turned out of confinement so that if something happens, they get spooked, they get out, we have a means of identification of those animals for that producer. There's many different producers out there. They all have their different brands. But again, the important thing when we are branding these cattle is to have adequate restraint and to be able to do that brand in a timely manner. We want to make sure our brands are functioning properly, whether it's electric or if they're still being fired by propane or wood. We want to make sure that brand is good and hot so that we use the minimum amount of time to brand those animals. Again, adequate restraint and a properly functioning brand are keys to successfully branding cattle in a good and proper manner for that animal. Thank you.
Say this is a calf that's been run through the chute a few too many times. Going through the chute stresses cattle, causing them not to eat like they should. Luckily, Pyramid 5 plus Presponse SQ provides proven protection against key respiratory diseases in a single shot, with just one trip through the chute. Talk to your veterinarian about Pyramid 5 plus Presponse SQ, and soon your calves will relax and eat like a whole different animal.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Beef producers asked for it, and the wait is over. Enroflox 100 Enrofloxacin from Norbrook, now approved for single-dose treatment and control of bovine respiratory disease, with the same active ingredient and dosing regimen as Baytril 100 in beef and non-lactating dairy cattle. Choose Enroflox 100 when looking for an injectable antimicrobial solution to treat and control BRD. Observe label directions and withdrawal times. See product labeling for full product information, including warnings and precautions. Consult your veterinarian to see if Enroflox 100 is right for your cattle. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
True Test Group, weighing systems, electronic identification EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Jim Lilyc, who's an associate professor in the Department of Anatomy and Physiology here at Kansas State University's College of Veterinary Medicine. And we're talking about regenerative medicine, where Dr. Lilyc is an equine surgeon, understands joints, tendons, ligaments, different things that loading the leg and moving and being athletic. And you know, while we know some things that regenerative medicine can do, what are some questions we still have?
Well, I think these are solid, legitimate questions. How do you know that the cell that you're taking from the fat has now become part of the joint? You know, and that's a difficult question to answer, right? So how do we know we're going to be able to, you know, because some get better and some get a lot better and some just stay the same. Nothing certainly is thought that we've made them worse. So we want to know what the molecule is. We want to know all the way down to what is that cell doing and making, because potentially we can recreate that in the laboratory and put that stuff on the shelf, right? So it doesn't necessarily have to, you know, if it's a generic type protein that's not something the body's going to react to, you know, create an immunologic response to it, because that's how vaccines in part work, right? But if we can put that on the shelf, then we don't have to wait for, you know, gathering or doing a surgical procedure to harvest the cells. We can use some sort of manufactured process to stimulate the healing. So if we know that, then we can get just a little bit better still.
Yeah, so basically, like when we're talking about they're either providing the tools or they're incorporating in the tissue,
right?
We're going to go just get the tools, harvest those from that tissue,
right?
And then you could use it, you know, in animal or people
or people, right?
Yeah.
And then we wouldn't have to use other medications. We wouldn't have to use a steroid. We wouldn't have to use, because there are toxicities associated with the drugs that make us feel better, right? You know, even from non-steroidal anti-inflammatories to steroids to, let's be honest, opioids, all right? I mean, yes, they're going to improve quality of life. Yes, you're alleviating pain, but there's still a price that you pay for taking those medications. If we can use something natural, then we really don't necessarily pay the price. So we don't know the exact cellular mechanisms. We don't know what a stem cell might need. We're getting much better at it, but outside the body to do and direct it to where it needs to go. Hey, we would like you to go into this bony area. We'd like to go into the joint. We'd like you to help us repair that, you know, and or in the tendon, or in the lung, or in, you know, heck, we could open up the door to the bovine mammary gland, the bovine uterus, you know, things that we can need to beat infections with.
I was thinking of
the bovine lung.
Respiratory disease would be huge
and,
if we could.
And get away from the use of heavy antibiotics or something along that lines. Certainly better for animal safety, for food safety, better quality of life, doing a better job of managing our resources, being stewards of our animals.
Well, the big thing is just saving the lives.
Exactly.
Having a positive outcome, and when we are struggling with coming up with some of the answers, I think there's some incredible opportunities.
I think I think we need to begin to ask those questions, right? You know, can this be useful? Can this be something that we use? Can we take it, with cattle, right? You know, can we take it from the cow itself or from the steer itself and ramp it up and give it back? Or can we make the molecule and put it on the shelf, and then they can be dosed or treated in a safe fashion?
Perfect. Folks, stay with us. We'll come back with our last segment on regenerative medicine with Dr. Jim Lilyc.
That's My Breed is brought to you by Stuckey Ranch. In today's cattle industry, Angus producers know how low maintenance and adaptable the breed is, and the proof is in the genetics. Angus cattle are known for traits that can make a big difference in cow herd profitability, including carcass value, marbling, and high growth. See how one South Central Kansas producer is using these genetics to increase the profitability in their herd and yours. The Stuckey Ranch of Kingman, Kansas is your source for Angus cattle that provide the best combination of calving ease and top performance with maternal efficiency. Their goal is to provide real-world, data-driven Angus genetics for progressive cattlemen. Take advantage of their long-term commitment to create value for your herd by selecting a bull in the annual production sale on Wednesday, March 9th, offering 175 14 to 18-month-old bulls, all with high-accuracy performance data testing and 50K genomics testing. Free delivery in the lower 48 states. See videos or request a catalog at StuckeyRanch.com.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher. Get the new hired hand for yourself or become a distributor. Visit cowsprayer.com. The new hired hand makes healthy cows easy.
Working your cattle just got easier. Introducing the new VetGun delivery system, a new way to apply topical insecticides to your cattle. The VetGun lets you remotely treat cattle with effective parasite control, so you can do it just walking among the herd. It's that simple. The proven topical insecticide AML VetCap is used with the VetGun. It works fast to control horn flies and lice while minimizing stress on your cattle. Fast, easy, effective. VetGun. Check with your animal health supplier for availability.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hey folks, welcome back to DocTalk. We're talking about regenerative medicine. It's something that is cutting edge, that's the future. It's here and it's the future. And this is Dr. Jim Lilyc, who knows quite a bit about it. He's an associate professor in anatomy and physiology here at the College of Veterinary Medicine at Kansas State University. He's an equine surgeon, world-renowned equine surgeon. We're lucky to have him on our faculty. We're lucky to have him here on the show, but so what are we going to do?
That's a good question for veterinary medicine. Certainly they've poured a lot of money into regenerative medicine on the human side of things. You know, Harvard's got a $2 billion facility, so that's billion. And where we're headed on the animal side of things, and I think we need to open the door more for the small animal side of things, because we know a whole lot more about what the horses are doing with that and whether that is helpful for the equine athlete. But for the companion animal, you know, the animal that's ridden on the weekends for fun or lives in the house with us, you know, the dog especially, I think we're going to begin to use their conditions and prospectively treat them. Can we harvest certain cells? Can we help those dysplastic dogs? And if we can find a way to make them feel better, they're in turn going to give us the information that's potentially going to help us. Certainly our lifespans are much longer than theirs, but you know, an aged dog at 15 is like the 75-year-old person potentially, or 85, and there's a big need to know that in human medicine, and certainly our pets are actually going to provide that for us, that information for us, those clinical trials that mean something.
Yep, and then there's some things that we can do with comparative medicine in this, so we can learn on animals and apply it to humans.
And hopefully if we can use what we know about the human stuff in the Petri dish, or in the laboratory, or where we grow the cells, then we can use that information back to help our companion animals as well.
Right. Well,
so we have to ask those questions. Hopefully we get the funded research to get the questions in the molecular avenues that we see, that we need to know about, and then take us to the next step. And that is more clinical trials, more directed therapy, refine it to the point where it's a known entity in what we're doing. Know all the mechanisms that are involved.
That's awesome.
Yeah.
Well, folks, regenerative medicine is something that is here. It's something that's going to change the future of both human and animal health. We have researchers like Dr. Jim Lilyc here at Kansas State University that's working on it on a day-to-day basis. Him and Mark Weiss, tremendous research potential. We appreciate you watching DocTalk. Remember, always work with your local veterinarian, and if you want to know more about what we do here on the show, you can find us at www.doctalktv.com. Thanks for watching DocTalk today, folks. I'm Dr. Dan Thomson at Kansas State University, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.